Depaul is a charity organisation, not-for-profit, working in both ROI and NI. So in ROI, we had to have 18 different services working with people who are homeless and people who are at risk of homelessness. Some of our services would be residential, others would be outreach services providing support to those who are at risk of homelessness and trying to seek tenancies and such for their move-on options.
Can you tell us why Depaul decided to offer employees a health plan?
So Depaul were looking to be a little bit more innovative on how we could reward staff, and we looked to the benefits package. It just coincided with me meeting Roy Smith from HSF Health, and he outlined the package that HSF Health offered to employees, and Depaul took it on board as a real benefit that would have I suppose an impact on all of our staff's lives, because everybody incurs some form of medical expense at some point throughout the year, be it dental, optical. You know, the big, I suppose, draw for Depaul was the phone counselling helpline, that staff had instant 24 access to a counselling helpline. Some of our staff would be involved in incidents on site, and they could work in chaotic environments sometimes. And that instant access to counselling was a real draw for us as a support to the staff.
How does it benefit the organisation?
Well, I think it benefits the organisation because at a time when staff were going through, the recession was hitting the country, staff weren't getting pay increases. It was an added benefit that staff really took on board, as in addition that Depaul was offering them, job satisfaction was impacted. And then as well as that, we have staff who we can be assured have access to the support that they need when they need it by way of that counselling helpline. It definitely supports the organisation with, retention, staff being happier in work because they have that added support.
Can you give us an example of how an employee benefited directly from the health plan?
You know, we'd have lots of examples of where staff would benefit from the HSF health plan. Numerous ones. I know one staff member who had used the counselling helpline and was really, really impressed at the fact that she had follow-on appointments with the same counsellor for the coming week. So she really appreciated that. Myself, I benefited from it only recently, where I had a knee injury and the whole mobility issue, not being able to move with the knee injury, and then the financial aspect on top of that with MRI scans and physio. And I had increased the benefit. So, within a 10-day turnaround, that was all refunded straight into the bank, which, it's a huge benefit to staff. And we'd have a lot of staff who would have private healthcare. But I suppose when I would be referring them to the HSF health plan, I would always say that while it's not private healthcare, it doesn't replace it. It absolutely enhances it because, with private healthcare, you're waiting till the end of the year to make any of these kind of claims. Whereas with HSF Health, it is immediate and it can be claimed along with whatever other benefit you have up to, what's in line with the different policies. So, it definitely is a huge additional benefit to any kind of health plan. Or if you don't have it, it's the everyday medical expenses that you do incur that you get some support with.
If you were to recommend the health plan to somebody, who would it be and why?
I've recommended HSF Health to lots of people in the past. So off the top of my head, people who have worked here and have moved on to other organisations have taken the recommendation with them. I know one staff member who they have implemented it in their new organisation. I've also recommended it to individuals to engage because I think it's a great benefit for anybody to have. It doesn't have to be through your employer, but any employer who want to enrich the benefit package of staff, they should look to HSF Health. Even if they're not going to cover the cost to enrol staff in it, but just to offer it as a benefit, I think it's a huge beneficial benefit to all staff that, any organisation would be the better of it.